This is the PVC or broomstick hip hinge drill. So you're gonna grab a piece of PVC pipe or take the head off a broom. I'm gonna hold this behind you. So I want this stick to hit me in 3 places, gently at the top of the head, between my shoulder blades, and then right here at the sacrum or the bottom of the hips. Then I'm gonna relax my knees. I like to do this little dance. And I'm gonna send my hips back, trying to keep all 3 points of contact with the stick. Push up by thinking about pushing my back pockets forward. Coming down, pushing back. Coming down, pushing back. So what we're doing here is trying to avoid rounding with the shoulders and rounding with the low back, or locking out the knees. Now, some people with really kind of exceptional hamstring mobility can lock out the knees and still do this, or I can do it if I really arch my back. We want to keep the knees relaxed and think about sending the hips backwards. Your weight should rock slightly back to your heels. And then to come up, I want to think about pushing my butt forward, squeezing my glutes at the top. So this can be a really important movement pattern for a variety of different conditions, including low back pain, hip pain, and sometimes even knee pain, because this is going to get us into the back of the body to allow us to access the glutes and the hamstrings without overloading the low back, the hip joint, the knees. So often it can be helpful to do kind of 10, 15 reps a couple times per day, and then try to do a few without the stick. What I think is helpful is have hands here, slightly squeeze the shoulder blades, relax the knees. I'm gonna think about reaching my fingertips towards the ground about 3 feet behind me. And to come up, push your feet into the ground, squeeze your glutes. So that's the hip hinge drill. It's one of the most common movement patterns that I find are difficult for people, but that can help a variety of types of pain and injuries.